Hello and welcome to this PIR live event, everyone, brought to you by Partners in Research Canada. My name is Stacey Joyce and I'll be your host. Remember that you can ask questions by using the integrated Zoom chat function. Don't forget to make sure you're sending those questions to everyone so all the students can see what other students are asking, and include your name, school, or where you're from to let us know so we can give you a shout out. So today's guest is Dr. Pia Kontos. She is a researcher at the Toronto Rehabilitation Institute, University Health Network, and she is also an associate professor at the Dalla Lana School of Public Health at the University of Toronto. Thank you so much for joining us. I'll let you take it away.
Thank you, Stacey. Good morning, everyone. I'm really very pleased to have this opportunity to share with you some research that I've done on what I think is one of the most exciting arts-based programs in dementia care, and that is elder clowning. An elder clown is a red-nosed clown who specializes in working with people living with dementia in long-term care homes. Now, before I move on to tell you more about elder clowning, I just want to pause for a minute and just say a couple words about dementia, because I'm not sure if you're all familiar with what dementia is. I'm sure you've all heard of it. Essentially, dementia results from damage to the brain, and this is caused can be caused by disease, most typically Alzheimer's disease, but it can also be caused by stroke. It can be caused by Parkinson's disease, so those are some examples. And dementia typically shows as memory loss, so people have difficulties remembering things. And it can also show as people having word finding issues, so struggling to find the right words when they're speaking. So I'm just going to advance to the next slide.
Oh, I don't see your slides yet.
Oh,
so
whoops.
To share them.
Sorry, 1 second.
Yeah.
Oh, now it's gone. Hold on 1 second.
No worries.
Can
you see your slides on your computer right now?
I can't.
Okay, you might have to reopen your slides in your PowerPoint program.
Okay. So here we are. Sorry, but then I have to escape in order to share? Or should I share first and then open?
You need to open the program first, and then we'll share, and then you're able to go full screen.
Okay, how's that?
Perfect.
Okay, terrific. Sorry about that. So probably best if I tell you what an elder clown is not. An elder clown is not a circus clown. It's really important to distinguish, between the two. And so there are really important differences between them. Elder clowns wear minimal makeup, very, very little makeup. And they also wear clothing from an earlier generation, like the 1950s. So you may see 1950s swing dresses, for example. Another important difference is that they tailor their interactions to the life history of the person living with dementia. And so these may be hobbies, personal preferences, what the person did for a living, and these details are typically gathered by speaking to the healthcare practitioners that are providing care for the person living with dementia, or family if they're there. So I have some images here of elder clowns interacting with people with dementia. You see that they wear a red nose. That's actually what makes them most distinctively clown. And in their interactions with people living with dementia, they use improvisation, humor, song, dance, instruments, magic, really quite a variety of things that they'll draw on to engage people living with dementia. They also importantly use body language. And this can range from subtle muscular movements of the face to more obvious gestural movements of the hands or other parts of the body. And within the context of severe dementia, where verbal communication is often limited, I mentioned that they often have difficulties finding words, then body language becomes even more important as a means to support communication. So I conducted one of the first studies maybe the first study in Canada that was nationally funded to look at elder clowns interacting with people living with dementia and how those interactions affect the person living with dementia. And so what we found was that after 12 weeks of the elder clowns interacting with the residents of a long-term care home, many of their symptoms reduced dramatically, quite significantly. For example, agitation is something that people with dementia can experience. We found that that significantly decreased, and we found a significant improvement in quality of life, and this showed as positive mood and positive engagement. So these were quite significant findings. And we used quantitative scales to measure those changes. But we were also interested in understanding the strategies and techniques that the elder clowns use when they're interacting with people with dementia. And so in addition to those quantitative data that we collected, we also interviewed the clowns so that we could talk to them about what it is that they do and what is most effective and why. And what we found was that they are incredibly attentive to and responsive to all that the person with dementia brings to the interaction, whether it's expressed verbally or non-verbally. And that's really a function of the training that the clowns have. So what I'd like to do is share with you a video clip, couple of video clips from our study. We videotaped all of the interactions between the clowns and the people living with dementia so that we could better understand what was happening in the interaction. And so in the following clip, what you'll see is the clowns are using music to support Betty's expressions. And in the first clip, you'll see that it's all nonverbal on Betty's part. And in the second clip, you'll see that she improvises this magnificent song with the elder clowns, and they're just so incredibly supportive of that. And then I've included a third clip from an interview that I conducted with the clowns, which I think is relevant here because they're actually reflecting on how it is that they're supporting Betty's musicality, her ability to express herself musically. So just, I wanted to tell you just a little bit about Betty. She's 80 years old, and she spends most of her days in her motorized wheelchair in her room with her arms folded, as you see in the image, with her eyes closed, and she rarely speaks. Her hobbies include singing and dancing. In the past, she was part of a community-based theater group and performed lots of musicals. And so the elder clowns use all of these details to tailor their interactions to Betty so that they're as meaningful and relevant as they can possibly be. So they'll often include songs and melodies from the style of musical theater from the 1950s.
Good morning, good morning. It's great to stay up late. Good morning to you. Good morning, we talked the whole night through. Good morning to you. Oh yeah!
responsive in her entire body to music and rhythm.
And complex rhythms. Because she's
complex.
varying when she comes in, offbeat. Her hands are like moving in different ways to the rhythm. It's not just up and down. It's like forward, back, side, forward, back. Or, like, it's so detailed. Even.
And when I can, I'm trying to kind of shape the music to what I'm seeing the patterns of her musicality. So she'll say some phrases, and musically speaking, and I'm no musician, but I'm musical. So I feel like, oh, a phrase is being completed. So da 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 da, da stop, and then there's a couple of beats that she also observes, and then she goes, oh, a big one. Like, here's the next verse. You know, like, so like she's observing structures of musicality as well as embodiment of it, and tone, like she's in tune. So there's obviously, she has music coming out her, you know, her entire being.
Yeah, and we're going in with something that then we let her take it over, and we start to follow her and let her and her build it, and we're supporting.
So why is this important? We think that what we found with the study is so important because it shows that people with dementia can be creative, they can be imaginative, and they can be expressive. And this challenges a lot of assumptions about people with dementia that they don't have the capability to do any of these things. It's also really important because we see that the elder clowns are able to fully support how people living with dementia can express themselves in these meaningful ways. As I mentioned, that they have very special training, and this makes them very attentive to and responsive to all that the person with dementia is bringing to the interaction. So for all of these reasons, we think that elder clown programs should be everywhere in every long-term care home. We are seeing them, they are increasing in popularity. We see them being implemented in Canada, in Australia, in Scotland, in Sweden, and the Netherlands, and by organizations like you see on the screen, Humor Foundation, Jovia, Hearts and Minds, and Fools for Health. And so, as I said, my hope is that they will soon become permanent staff in all long-term care homes. So that brings me to the end of the presentation part of what I'd like to share with you today, and I look forward to your questions and comments.
Well, that was great. Thank you so much, Dr. Contis. I find that these examples are quite powerful. I think many of us know someone who's been affected by dementia, and that assumption that people make that there's no function there anymore, and maybe a lack of personality. And you can see in your photos and in your examples that there's certainly a lot there that we can tap, and there are interesting ways to bring that out. So our first question comes from Port Dover, Ontario, and they would like to know, how do you help dementia?
Well, a lot of research is happening in the area of medications. There are medications that are prescribed for people with dementia to help them with their symptoms. I'm not a medical doctor. My research is focused more on improving the quality of life for people living with dementia. So there's lots that we can do to help people with dementia to live well, and offering opportunities for them to express themselves in meaningful ways through the arts is a really important strategy, because the arts are so supportive of nonverbal communication that they're really well positioned to support people living with dementia well. So I would say we need to invest more in the arts to really help people to live well. And it's not to say that medication, there isn't a place for that, but I think there's much more that we could be doing to provide opportunities for meaningful engagement, so activities that allow people with dementia to fully participate.
Lovely. And I just would like to ask you if you can stop the screen sharing now. We'll be able to See a
Sure.
larger window with your face. Perfect.
Great.
So question 2 comes from London, Ontario. What is included in training for elder clowns?
Oh,
They
what a great
seem-
question.
Yeah, they seem to really understand how to interact. So how do they
Yes.
train to do that?
So the elder clowns that we worked with are all professionally trained actors. So they first are trained as actors, and then they go on to specialize in clowning. There actually isn't a standardized curriculum for elder clowns. So if you look across the countries that I've mentioned where these programs are increasing in popularity, they're very different. So they range in duration of time and what's actually being covered in terms of the teaching. But I think that what I've gathered from the literature is that learning to be fully present is fundamental to their training. And that means being able to be with someone and suspend all judgment about what it is that you're seeing and not measuring what you're seeing in relation to maybe what you've seen in the past. So being fully present in the moment is something that is really key to their training.
Excellent.
But the musical, like they all have some training in music, so whether it's singing or playing instrument or dance, and a lot of that comes from their training as actors.
Well, and that brings me to my next question from Joseph, who is 12 years old. He would like to know, in your work, has music been the most important way to heal the human brain?
Great question. So in my observations of the elder clowns, I have found that music is very powerful. There is a program, if you're interested in the power of music, particularly in the context of dementia, there's a great documentary you all should watch. It's available on Netflix, and it's called Alive Inside. And it's about, it's a documentary that follows a social worker named Dan Cohen, who brings iPods to nursing homes and then personalizes the playlists. And, according to the music that the people with dementia enjoy. And it is nothing short of magical what happens when they put the headphones on. These are people that for a long time may not have communicated at all, and they literally come alive. So what it demonstrates to me as a researcher is that capacity to communicate is already there, and music is a very powerful way to support that communication.
Wow. So not everyone has that really strong tie to music. Have you found any other examples of something that has just really brought a patient out of their shell that wasn't musical?
Yes, I mean, there are lots of examples where drawing, for example, I mean, the clowns will typically carry a notepad and pen with them, and that has become a powerful way to make a connection with somebody. So I'm thinking of a resident who they sat down and drew a picture together, and it was just beautiful, but the interaction. There have been examples where they've drawn on their knowledge of what the person with dementia did for a living before, and then they drew on that information to make a connection. So, for example, there was a male resident who owned a delicatessen and sliced meats for most of his life, and so they engaged in this almost like this joint storytelling about deli meats, about pastrami and smoked meat and salami. And so it doesn't have to be musical. These, I think, are really nice examples that show that.
You must find this research to be quite rewarding in very unexpected ways, with stories of deli meats. And
Yes. Well, what it does for me so powerfully is it's a powerful reminder that people living with dementia are not empty shells, which is such a common assumption. They are people, and they've lived lives, and they have so much to share. And we have a responsibility to support that.
Lovely. So a few questions then, maybe more from the research perspective and performing this research. You mentioned that you found a decrease in symptoms with this elder clowning study in particular, and an increase in positive moods and other indicators. So you also mentioned qualitative scales. So from planning and executing a research perspective, what did that look like with qualitative scales and deciding what to measure and how to translate that into results, meaningful?
Yeah. So, so this was what's called a mixed methods study, where we had quantitative scales, and we used those to measure changes in particular symptoms like agitation, and quality of life. So, as you said, engagement, mood, those sorts of things. And so we collected all of those measures before the clowns started interacting with people with dementia, and then again afterwards. And so it gave us the ability to measure change that resulted from the interactions. In terms of the qualitative, and I'm actually am a qualitative researcher, that's really my strength. We interviewed all of the clowns. We also interviewed the staff who were there observing these interactions, and all of the family members were there as well. And so we used these interviews as a way to delve in greater depth, you know, what was actually happening in the interactions, their perspectives on the power of that, and changes that they may have observed that our scales may not have captured. So the mixed method design, I think, is really powerful that way, because there isn't one method to capturing the entire picture.
Right. So did you find that there were any particular challenges either with this study or with qualitative research in general, as opposed to something that is entirely quantitative?
Not so much challenges, just really reinforce the benefits of combining these methods. I mean, in the world of health research, numbers are important, and so to have collected the data that can now allow us to say agitation decreased significantly, quality of life increased positively, that tells a piece of the story. And then the qualitative really, the benefit in this case was that it helped us to understand the strategies and techniques of the clowns, which we wouldn't have understood with just the measures alone.
Right. So how did you find your way to this career in qualitative research? What did that path look like?
Well, it started when I guess when I was doing my undergraduate studies at university. I was always drawn to stories and narrative, and less drawn by numbers. The numbers, I was never very good at math. It didn't speak to me in the same way that narrative did. So I was just naturally drawn to that method. I also have, I took a lot of anthropology courses, and so I've always had an interest in people and doing observations and really understanding how people interact with each other, why they do what they do, and what the meaning is of that. So it's the meaning that draws me to qualitative methods. You know, it's not so much whether something works, but why does it work? Why do the clowns have this transformative effect on people living with dementia? So it started, I think, just a long time ago with my intrigue with storytelling.
Right. So it's nice to hear, though, that math really wasn't your thing, and that doesn't mean that you have to shy away from science or experimentation, research, that there is another way to pursue that.
Absolutely, absolutely. In fact, there's a real recognition now of the importance of qualitative research in the context of health, in the health field. So there's lots of opportunity to do qualitative research in this area and other areas.
Excellent. Are there any other areas that you are pursuing qualitative research in at this time?
Yes, I do brain injury research as well. And you might be interested to know that I use theater a lot in my work. That's also the qualitative side of me. And so we've taken qualitative research that we did to understand the experience of people living with brain injury. And we collaborated with a theater director and playwright and created a play about this. And we use this now as a way to help to educate healthcare practitioners, to sensitize them to the perspectives of the people themselves living with brain injury. So that's another area of research. And then I also do some research on exercise and older hemodialysis patients. Again, though, using the arts, we've created a short 15-minute film about the importance of exercise and why older hemodialysis patients aren't exercising more. So those are some of the other areas of my work.
And maybe just quickly, can you describe that condition of hemodialysis, or that?
It's people that experience kidney failure. So their kidneys aren't working properly. So they have to undergo dialysis treatment where their blood is really removed from the system, cleansed, and then replaced. So it's a very lengthy process. They're there in hospital often 3 days a week for 4-hour treatment sessions. And so they really are a captive audience there. And so I thought, well, if exercise is so important, maybe there's a way to encourage exercise during dialysis treatment. And it's been wildly successful. They really enjoy it. It helps to pass the time, and it's really significantly improving their function.
Excellent.
Yeah.
So we're just running out of time. I think maybe one more question. And just wondering if you have any words of wisdom or advice for any students out there who maybe thought that research wasn't really for them, and they had all this leaning towards the arts instead of the sciences, and if they do have an interest in both, how to pursue a pathway similar to yours, or what to consider.
Well, I think that there is, I would encourage you all to pursue that. I think there's so much possibility in research to incorporate the arts and qualitative methods, and I do think that is key to us improving the health of Canadians. It's not just about medication and quantitative approaches to improving care. We really need to better understand what's working well and what isn't working well, and to use that to inform programs to improve care. In terms of how you go about doing this, I think that I have no background in the arts. I'm not artistic at all, and so it was really important that I collaborate with artists. So it's not that you have to be able to do it all on your own. I think it's important to make connections with people that have the expertise that will help you to achieve what you want to achieve. So don't feel discouraged if you can't sing. Hire a clown.
Absolutely. I think that collaboration gets overlooked sometimes, and that we do feel we have to do it all. So that's great.
No, team-based research is the way. It really is.
Perfect. Well, that's all the time we have today. Thank you very much, Dr. Contos, for joining us today, introducing us to elder clowns and some keys to doing qualitative research. And just overall, thank you so much.
You're very welcome. Thanks for joining, everyone. Bye.
So next week on PIR Live Event, we are talking about food waste. For more information on this and other live event webinars coming up, have a look at pirweb.org. Thanks for tuning in. Have a great day, everybody.
Bye.